Today on This Week Health.
How do we move just out of care and more into health? And so that's a business diversification play. If we want to be relevant with the consumer of today and in the future, it means more than procedures, more than just when you walk into our hospital and leave. We've got to figure out like the 5% of healthcare that embeds in the 95% of someone's life.
Today on Town Hall, we had the honor of being invited to the Scottsdale Institute conference in Arizona. And while we were there, among so many great health IT leaders, we were able to capture a couple of conversations about their thoughts and work in the industry. And we thought we would share them with you on this channel. So here's another one of those interviews from the Scottsdale Institute.
All right, we are here with Nick Archer, and you are with AdventHealth and Venture. What's your actual title?
Yeah, so Venture is operations. So I've got responsibility for building new businesses, delivering new products for the organization, and primarily that have a risk focus. So I'm building businesses that help us take risk and that we likely can sell to other value-based organizations that are taking risk.
Fantastic. So what's top of mind? What are you looking at well, Advent's all over Florida, right? It's not just the Orlando market.
Well, not just Florida, so we're 9 states. So 51 hospitals,
Texas,
9 states, primary footprint in Central Florida, Tampa to Daytona. It's the majority of our system, but we do have operating markets outside Florida as well.
So what's top of mind for you right now?
Yeah, my focus is right now, hospital at home is big, again, as we think about building risk-bearing capability and the future of MA growth in markets that we have. Hospital at home is something that I'm focused on and responsible for. Also virtual care. We are looking to build out not just on-demand virtual services and not just scheduled virtual services with our existing providers, but starting to think about some of the supply-demand challenges as a health system, and so how do you use virtual care to help augment support through partnership or other specialties that we may not have, some of the access that consumers are looking for. That's another area of focus for me right now as well.
So talk to me about your role. It's interesting because in a traditional health system, it's hard to do some of the things you just talked about, to think differently about how we're going to do hospital at home. Because hospital at home could potentially be a different business model than putting another 100-bed hospital here and another 100-bed hospital here, or some of the other things. Talk about how you're organized and why you are organized that way.
Yeah, last year our organization started this ventures division, which is not venture investing, but ventures in terms of new businesses, and structured in a way that separated it from our core hospital operating markets. So our hospitals are focused on kind of integrated delivery in their markets. And then our ventures division, which I report up through and part of, we're building out new businesses, again, to support our ability to take risk. And so separating them, I think, is super important because we're chasing different dollars and different business models. And so that's been helpful as we've started to grow and evolve.
So hospital at home and virtual are two interesting things. We just talked to OSF. I've talked to John Halapka before, Mayo, and some of the things that they're doing. What kind of infrastructure do you have to put in place to support hospital at home, to support that virtual outreach to the community?
Yeah, so for us, we're taking a partnership approach. So we're likely not going to build the infrastructure to be able to do hospital at home. We're going to acquire some of that through partnership. But we do have home care operations, hospice operations, rehab, all these things that already happen in the home, which are key inputs that you do need to deliver and to support hospital at home. So the broader post-acute infrastructure that we have in the markets we're operating in actually become a key input to the success of hospital at home as we bring on that capability and the resources needed to deliver that in our markets.
What partnerships are you looking to? Is it actually standing up the home, putting the technology in the home? Is it actually the logistics, the monitoring that needs to go on an ongoing basis?
Good question, yeah. So we're going to take a build by partner approach with most of the things within our ventures portfolio. And so with hospital at home, we're likely going to JV. And so we're looking for a partner who can expertise in logistics, delivering the actual clinical care in the home. So again, there are things that we bring to the table that we've got expertise and years and experience. So we have mature markets. Obviously, these people are going to end up in the hospital, so that's a core supportive piece. Again, I mentioned hospice and home care and other related post-acute services. You need to provide DME to do hospital at home. So we've got some of those infrastructure pieces, and then partnering with an established hospital at home provider that has the logistics and care infrastructure and algorithms of how to actually run the business. You put those two together and you get something that can hit the ground running in a market and be successful.
Are these new services, let's take Orlando, a significant market for you. So are these new services for this community or just a different way of receiving them? Would they have traditionally gone into the hospital, gone into the ED, gone into the, are we looking to increase access? What's the driver?
Yeah, I think particularly in the Orlando market, this is a first to market opportunity. I mean, there are provider-based groups that are doing home-based care, but definitely not at the scale at what we're talking about. So it's really about bringing the scale operation of hospital at home to the market. And so yes, patients that certain DRGs that can be taken care of in the home, looking at post-hospitalization care over an extended period of time to prevent readmission, building a SNF at home program. All of those are components that may operate in some niche, or maybe an ACO is doing something, but not really brought in scale to the market. And so that's what we're hoping to do.
It's really interesting. And so I don't want to call you an incubator, but essentially you're launching new businesses. You're dreaming up new businesses. How much of that is the leadership team of Advent sitting around and saying, okay, these are the pillars or these are the focus areas that we want to go at? And how much of it is just greenfield sitting in front of a whiteboard and saying, all right, what services, or potentially talking to the community and saying what's missing?
So I think for the first part of the work we're doing, it is kind of what the company has looked at, really looking at our portfolio. And so if we're going to grow our risk revenues from where they are to 10 billion over the next 10 years, there are certain services that you're just going to have in place. And so that hits at that ability to take risk. If you can't do hospital at home, you can't provide post-acute services, those are going to be key to us being able to manage risk and significantly grow revenue, grow lives, so we need to do that. Then there are other things that we're doing that are probably more blue sky. So we're going to launch AdventHealth Lifestyle, which is really a business component of how do we provide really wellness services to the home, and so partnering with developers.
So using builders. Remote patient monitoring to be more involved in everyday health.
Not just. So I mean, I think remote patient monitoring is one piece, but when you look at this,
remote consumer monitoring.
yeah, or remote health monitoring, so many different acronyms. When you look at the spectrum of wellness and what it means for the average individual, that's nutrition, it's supplements, it is wellness from the standpoint of exercise and yoga. All of those are things that we think we can help orchestrate and play a role in, play a credible role. There's a term that we use called science-backed self-care. How do we play a relevant role taking the science and expertise of a health system like ours and package that together with things that people are using, desire to use, or have questions about in their everyday life to make their life more meaningful and to make their lives whole. So that can mean a lot of things. It might mean monitoring in the home, but there are things that are not centric to monitoring and devices that we know we can play a role in, and we want to figure out how we can build a business around that type of activity.
Yeah, I've had this conversation with a lot of people of my car has more sensors on it, and the dealership is more in tune with what's going on with my car than my health system is in tune with what I'm doing, and I have very few sensors on me that is communicating with the health system. It would be interesting to establish that relationship, that ongoing relationship.
Absolutely. I mean, those are things that we've talked about, and I think the key in your example about the car, it doesn't just give you a light, it tells you what's wrong and what you need to do.
Yeah.
And so the remote monitoring is still a little bit of in its infancy. You've got a lot of data and a lot of information, but not a lot of direction and action that can automatically be taken. And so that is the evolution. That's what's happening with our Apple Watches and Oura Rings and all of these things. It's the insights that drive change, drive adopting different behavior that we need to figure out and partner with consumers on.
Yeah, we should probably do a longer conversation because I'm going to end with a really big question, which is, you're looking out there, a couple years out there, and hey, this is what healthcare could be in these communities. But I wonder how much of that is driven by the backdrop of the staffing challenges and the staffing shortages that are going on now that says, hey, there's a potential new paradigm that we need to be exploring, just because I'm not sure we will ever have, and this is me speaking, I'm not sure we will ever have enough nurses again or enough primary care doctors again, because of just there's an ongoing shortage around the country. How much is driven by that reality, and how much is just looking out and saying, no, this is where healthcare was going anyway?
Yeah. I think my hope is naturally that they come together, but a lot of what we're doing and looking out is really greenfield focused. How do we play a new and different role? How do we move just out of care and more into health? And so that's a business diversification play. It's playing a role of relevance in people's lives. And I think we've realized yes, there's pressures on the hospital side, but if we want to be relevant with the consumer of today and in the future, it means more than procedures, more than just when you walk into our hospital and leave, more than the 2 times maybe that you see a doctor a year. We've got to figure out like the 5% of healthcare that embeds in the 95% of someone's life, as opposed to thinking about only when they come to us and when they're captive in front of us. And so that'll be an evolution over the next few years for the company.
Fantastic. Nick, thank you for your time.
You're
Appreciate
welcome.
it.
No problem.
I love this show. I love hearing from people on the front lines. I love hearing from these leaders. And we want to thank our hosts who continue to support the community by developing this great content. We also want to thank our show sponsors, Olive, Rubric, Trellix, Medigate, and F5 in partnership with Sirius Healthcare for investing in our mission to develop the next generation of health leaders. If you want to support the show, let someone know about our shows. They all start with This Week Health, and you can find them wherever you listen to podcasts. Keynote, Town Hall, Newsroom, and Academy. Check them out today, and thanks for listening. That's all for now.